Okay, let's get a hold of this big guy. Almost looks like a duckbill. Hey everybody, it's Dr. Nicole Freels here at Lexington Podiatry. I have a really great case of some toenails coming your way. Stay tuned. I have the nails trimmed. I'm going to pull this out just a little bit more.
Last time I had what?
Had your toenails trimmed?
I never had them trimmed.
When is the last time that you because you said that you get a hold of the big toenails, but the other ones, are they more difficult to trim? Some of them are quite thick.
Some of them got that, I guess it's,
We got some buildup in some of these corners, so we'll get all of them cleaned up. You should feel much better when we're done. Would you like to come every couple of months for us to trim them and keep them maintained for you, especially as a diabetic?
yeah, I guess.
Okay. Well, we talked about you having the neuropathy. You know, sometimes it's hard to feel where to stop trimming with diabetes. Plus, having a poor circulation, it will, if you do nip yourself, it'll take longer for it to heal.
I got that, damn
How
little
long that
bug
is.
in my,
Are you talking about the fungus?
yeah.
I think everybody's seen those Lamisil commercials where the little bug's living under the nail. Yeah, it's really easy to get.
But they don't eat much, so I don't pay no attention.
I love it. You know, and this is purely a cosmetic issue. I mean, sure, it can be uncomfortable if they get too big or too thick. It'll cause pain just from the thickness and the pressure from the shoe, but most of the time, it's not going to cause you any harm. Okay, and we're going to, of course, get all the length, then we'll go back and get the Dremel and smooth all that down. Get a hold of this guy here. How you doing up there? So far, so good?
Yeah.
Hard to get a hold of him. Did you soak your feet today or take a shower right before you came in?
Yep.
Thank you. I can tell the nail's nice and soft for me. Makes it easier to grip it. I can get a lot more of it. Okay. That little pop socket's out. Okay. Get a lot of the thickness down with the Dremel in this one. I'm gonna tilt your leg just a little bit so I can get on that edge a little bit better. Okay. So underneath here, you're kind of thinking, well, how much is skin and how much is nail? There we go. You got a little blood spot on your toenail here. Did you drop something on it, or do you recall bumping it in any way?
Not that I know
Okay. See right there, little subungual hematoma. Now you can get something called a melanoma. You're not having any pain in this area, are you?
of. No.
Good. If that ever changes, you let me know, but we'll keep a close eye on it. But I can see how it's got a reddish purple hue, so that tells me it's some blood underneath the nail as opposed to some type of malignant mole or anything more severe. Look how much we're able to get off. Whew. There we go. Look at that, Caitlin. A little bit at a time. More time consuming, but Better to go slow than create pain, discomfort, or trauma. Alright, that's pre-attached. We'll get the Dremel on that little guy. Okay. And you're going to use the cream, because we had talked about the athlete's foot on the skin, on there ideally twice a day. And that's, like I said, an inexpensive prescription we'll have at your pharmacy. That skin really looks like it's creeping up underneath that nail. There we go. So this gentleman is a diabetic as well. So with neuropathy, peripheral vascular disease, highly recommend getting your toenails trimmed. A lot of patients come in and wonder kind of how do you know they qualify, and either the primary care doctor can determine that, or you can go straight to a podiatrist. Most podiatrists don't even need a referral at this point, and they will let you know on the spot if your insurance should cover or not. And if they do cover it, it's generally every 9 weeks or 61 days. And we're gonna get this gentleman set up with some diabetic shoes as well. You okay? Not hurting you, am I?
Yeah.
Okay, let's get a hold of this big guy. Almost looks like a duck bill. What do you think? It's kind of just layering and layering, and then it's headed in another direction. So what are some common questions we get, Caitlin? What can we talk about? Why I hold my nippers this way?
What causes the toenails to look like this? People ask that a lot.
It's fungus. Fungus causes it to layer and layer and thicken. Also trauma can happen. Generally, it's one toenail. So it will just build on itself. And it's so common to get it, you know, the more birthdays we celebrate, our immune system weakens, and, you know, our feet are our shoes are dirty. We don't wash our shoes. At least I don't. And it's so easy to pick it up. So it's not necessarily a hygiene thing. It's just the way it works. So any autoimmune issues can make you more prone also to developing fungus. This one came off quite a bit easier, didn't it?
Mm-hmm.
Yeah. Okay. So much more helpful having the nails soft. Okay. Little bites at a time. All right. Okay, well, let's start dremeling. Any other questions, Caitlin, you can think of that we can answer while we're whittling away here?
Yeah, I saw a comment the other day about the journals because we were just talking about that. On, I guess, how to specify the difference between one that you would use for woodworking and one that you would use in toenails.
Well, that's an excellent question. Basically, one that you can buy in a hardware store, or Lowe's, Ace Hardware, Home Depot, is not for personal use. And not for nails. So if you look at more so for one from a beauty salon, that would be one, or kind of the beauty stores. You know those. What's it in town? What's the one in town called?
Are you talking kind of like a? The only thing I can think of is like a Sally's, but I don't know if Sally's would sell something like that.
I don't know. I mean, they may sell. I mean, I can't believe that they even sold that pet egg. You okay? To begin with, but you never know. Okay. Good deal. So yeah, in that little my instrument kit, I have rasps to use, but I think one of the other doctors must have used it before it could get autoclaved and turned over, which tells me we need to get more sets of those.
Yeah.
And when you go home, you might want to just soak your feet really good and get in between there. You've got a lot of debris that had built up. Okay, let's get you lotioned up. How does that feel? Feel a little better?
Yeah.
Good. I'm just gonna put some lotion on you, and then we'll get you out of here.
That's good.
I'll put these together just a little bit. All right, guys, if you like these videos, don't forget, subscribe to the channel, comment below. Thanks for watching again. See you next time.